At a time when getting basic medication to deal with COVID has been a nightmare across the country, a doctor couple in Mumbai has decided that they just must get out there and help by collecting medicines from those who have recovered from COVID and providing them to needy patients. On the 1st of May, Dr. Ranney and his wife, Dr. Raina Ranney, started Meds for More, a citizen initiative to collect unused medicines from COVID-recovered patients. Dr. Raina Ranney and Dr. Ranney join us at this stage. Thank you both very much for being with us. Makris, let me come to you first. Could you just give us an idea of the impact that collecting this medicine has already had on people who need it?
The whole idea with this initiative is to reduce the waste and increase the efficacy. And we were seeing that firsthand because a lot of our own patients living in high rises just naturally had leftover medicines, just given the nature of the blister packs. And so we thought this was an effective way of bringing that and providing it to people with no access and no affordability. In as little as 10 days since we launched this, and it started in the building where we live, we've already collected somewhere close to 30 kilograms of medication just from this one city alone. And we're very pleased to say that in the next few days, and hopefully on Monday, we'll be activating cities across the country, including the capital, Bangalore, Ahmedabad, and Kolkata as well.
Raina, what medication?
Sorry?
What medication are you collecting?
Yeah, so right now the main medication that we're collecting is everything that has been used for COVID. So anything from pain relief to fever to steroids to even FabiFlu, antivirals, anti-allergies, anything that can be used to treat COVID patients is what we're essentially collecting. We've also had people donate a few other medicines which haven't been used in the COVID efforts.
Makris, the big worry, of course, is that some of these medications need to be taken under prescription, that also under very strict guidelines and the like. Therefore, when you're collecting these medicines, how careful are you before you are actually, because everybody wants remdesivir, it's not prescribed in many cases. A lot of people want other drugs. Again, it's not prescribed. So how do you ensure that that doesn't happen?
So we don't receive the medications like remdesivir and tocilizumab, etc. These are the commoner medicines which are used in mild to moderate treatment cycles. Our partnerships with NGOs across the country provides for the mechanism where they have the right licenses and permissions to ensure that these medicines are then given to people under the provision of a state-based doctor through a proper formal prescription. So we're very careful in that entire process. And what we are mainly doing is acting as an amplification channel to bring the mission from people who have to provide it to people who don't have.
And Raina, one final question to you. You would need to be very careful about the medicines you collect, right, to ensure that the seal remains, that the date is valid. How do you ensure that that takes place?
So till now, we've been receiving the medicines from our end. We've been checking the expiry dates and we've been segregating the medicines. It's been happening under the supervision of doctors. So we've been very careful on that front and we continue to plan to do it in this way going forward.